biggest challenge that physios have is session one. They come in, they do the subjective assessment, they do their objective assessment. Most of them know what's going on. It's like, right, okay, now what do you do? You've got a patient in front of you that's never seen you before. How do you turn that into, I'm completely on board and I'm going to do anything that you want me to do or ask me to do? So the way that I teach this to my staff is something called a CLOSE framework. So CLOSE is an acronym. So the C stands for confirm. So just confirm to the person what it is that's going on. Now, given the medical terms, not enough, Andy. You can't just say, oh, you've got a disc herniation. It's not enough. You've got to follow it up with some normal language that they can get their head around. They can picture it. So you confirm what the problem is in language that they understand, given the medical term, but in language that they understand. Now, the next thing that needs to happen after that is they need to understand why it's happened. This is where you become an expert as a physio. It's, right, that's the problem, but I'm interested in why it's happened, because people don't just herniate a disc. There's a reason for it. They need to have this light bulb moment where they go, that makes sense. So the L is link. So you've got to link your objective findings to the thing that you've just told them is going on. For example, it might be that you say you've got an Achilles tendinopathy. What that means is your Achilles tendon's got swelling around it. And the reason it's happened is because your foot arch is really it's collapsed, and that's stressing the Achilles tendon, or your calf's really tight, which is then putting too much tension on your Achilles tendon. They need to go, yeah, that makes absolute sense why that's happening. The next bit is outline the plan. And this is another bit that stumbles people up. People often give a plan and it's just got no structure to it at all, or they give them too much, or they sell them something that they don't want. If you've got a builder coming in with back pain and you're talking about like doing core work at the end and doing reformer Pilates, you've lost him. Let's get real, Andy. He's going to come in 3 or 4 sessions, get to a point where he's comfortable. You might get him to do some stretches a couple of times a week, but let's have an honest conversation here. You're going to need to come in every couple of months and have it maintained, because I know you ain't going to do them. I just know you're not going to do it. When it comes to outlining the plan, it's like, right, let me give you the plan in order of like how we're going to go from where you are now with raging sciatica to getting you back on the building site in the gym 3 times a week. Keeping it really simple, not overcomplicating it, not blinding with science. The next bit is you've got to sell the why. That selling the why might be, Andy, you've got a marathon coming up and you've come in with a bit of ITB friction syndrome. I know at the minute it's not stopping you from running, but we really need to get on with this and sort this out now before it becomes a bigger issue and it actually stops you from running. And I'm mindful that you've got your marathon coming up in 3 months. That's sell the why. Like, I know why I'm here now. I know why I've got to act now on this. And by the way, selling the why, sometimes me selling the why is, I don't really think you need to have a load of physio on it. I'm not talking about trying to sell something they don't need. I'm talking about selling something that will absolutely benefit them and give them the outcome that they want. So sell the why. Another way you do that is talk about the consequences of not doing it. You know, if you've got someone coming in and they've got saddle anesthesia, well, at that point, the plan is you need to go to A&E. Well, you better tell them why they need to go to A&E, because if they're going to probably leave feeling a bit disgruntled because you haven't done any soft tissue work with no real understanding why they need to go to A&E, and then they're going to end up with like some severe neurological problem because you haven't sold the why. Sell them the why you need to go to A&E. I did the other week, a guy come in, he had a partial osteotomy. He was 8 weeks. His whole lower leg had swelled up. It didn't look like a DVT, but it was swollen. I was a bit suspicious of it. And I tested his dorsal pedis pulse and it's just a little bit faint. And I was like, there's no redness, there's no real point tenderness in the calf. I just said to him, I'm not happy with this. I feel like you need to go to A&E with this. Really? Why? I said, explain what I'd found and made the link. And I just want to know it's not a blood clot. I don't think it is. But anyway, he went to A&E, rang me that night, said, I've got a blood clot in my leg. So sell the why. If I'd have not explained all that to him, he wouldn't have gone. He could have ended up with a PE. So sell the why is a really important part of the plan. And then the last bit, and this is the really important bit, is the E, which is explain the next step. So when they leave, don't let them leave with the whole thing in their head, because they'll never retain it and it will confuse them. Just leave them with the very next thing that needs to happen. So in his case, it was, let's not do anything other than just get this ultrasound scan and get your bloods done, and then we'll have a chat after that. Or it might be, let's just keep it really simple. Let's just have 3 sessions a week apart, and then we'll review your progress after 3 and rewrite the plan at that point. Great. So when they go home and they sit down and they have the sausage and mash and beans that evening with the wife, she'll say, how did you get on at the physio? He's got all the information. He can explain it in a way that he understands it.